Hello, my name is Cheryl Smith. I'm a graduate student at Liberty University in public health. This project is about understanding and utilization of an electronic health record patient portal. Advanced slide. The goals of this project were to aid a local rural family practice office in meeting the stages of meaningful use and being able to align with the Healthy People 2020 goal and objectives of using healthcare information technology. Completing this project and meeting meaningful use requirements will enable the office to be eligible for CMS incentive reimbursements, as well as being able to better serve their patients and helping them to take part in their own healthcare management. Advanced slide. Healthcare as we know it is a dynamic entity. At the ever rapid pace of technological advancements, we can now be utilizing these in the health field. The ways we can use them are many and varied. New technologies in healthcare exist in diagnosis, treatment, prevention, planning, useful for policy making, and they're also essential for information and record keeping. Advanced slide. Technological advancements such as computers and the internet have shaped and changed the way healthcare information is both recorded and accessed for future use. Rapidly fading are the days of the large binder at the nurse's station in Iraq with the patient chart on it. In the vast majority of hospitals nowadays, you see nurses and doctors zipping around with computers on wheeled carts, utilizing wall-mounted computer stations, or even using handheld tablets. With the advent of the internet and cloud storage and sharing, the way that we now record, store, and access health information is on the way to becoming mostly or even completely electronic in the near future. Advanced slide. Healthy People started in January 2000. It was started by the United States Department of Health and Human Services, and it provides a science-based national goals and objectives with 10-year targets that are designed to guide national health promotion and disease prevention efforts, and also to improve the health of all people in the United States. Since January 2000, Healthy People has established 1,200 objectives and 42 target areas. This program sets benchmarks and monitors progress over time, and it wants to achieve goals that will enable greater health care as well as equitable health care to all people in the United States. The benchmarks that it has been, advanced slide. The benchmarks that it has set has included engaging multiple sectors to take actions to strengthen policies, improving practices that are driven by best evidence and knowledge. Another one is identifying critical research, evaluation, and data collection. Advanced slide. Healthy People acknowledges the fact that while healthcare is dynamic and a changing field, it's also one that's very regulated where healthcare is concerned. Providers, facilities, vendors, and other related third parties are subject to a variety of local, county, state, and federal laws and mandates. Advanced slide. The Healthy People 2020 goal of utilizing health information technology to improve outcomes, quality, and equity of healthcare also aligns well with another federal mandate. The American Recovery and Reinvestment Act of 2009, one of its provisions specifies that $27 billion is to be used over 10 years to aid in the adoption of electronic healthcare technology. Advanced slide. This act states that three main components of electronic health record technology will be utilized through what's called the Meaningful Use Program. The components consist of use of electronic health record technology in a meaningful manner, an example being e-prescribing, The second component is to use certified electronic healthcare record technology for exchange of health information in order to improve the quality of healthcare. The third component is the use of electronic healthcare technology to submit clinical quality and other measures for monitoring. The stages of meaningful use were originally slated to be completed over a 4-year period, but since then several extensions have been granted. Advanced slide. Stages 1 and 2 of meaningful use were broken down into objectives, core objectives, menu set objectives. For each stage, particular ones were to be met. Although some objectives in Stage 1 and Stage 2 include some uses for the patient portal within the electronic health record, in Stage 3 it becomes a vital part of meaningful use and has specific items that must be met by certain percentages in order to qualify for the monetary reimbursement incentives set out by CMS. Advanced slide. This project was conducted in a rural family practice office located in the northwest Idaho Panhandle in Boundary County, in the town of Bonners Ferry. This town has a population of about 2,500 people. This town started from a river crossing for prospectors that were heading to the gold fields in Canada in around the 1860s. And in fact, Canada is only about 30 miles north of the town. The town itself is bisected by the Kootenai River. It has tribal lands around it from the Kootenai tribe of Native Americans also. The town itself sits in a large valley and it's surrounded by 2 mountain ranges on either side. The family practice office sees patients both from Bonners Ferry as well as the many other small surrounding communities, because there's quite a lot of small surrounding communities within the Bonners Ferry area, and they're actually so small that they do not have oftentimes even stores, much less healthcare options, practices, offices, or anything. The family practice itself is small. It's got 1 medical doctor and several mid-levels, but they see an average of 50 patients daily and can even exceed this on many days. Advanced slide. The practicum site for this project, this family practice office, is very late in adopting the stages of meaningful use. They do use an electronic health record, but they're only using small parts of it, and they still rely heavily on paper charting for many things in the office. They have not utilized a patient portal at all in conjunction with their healthcare record, even though they do pay for services in support of one with their software. While their software accounts for one, there's been no one on staff that's been trained to utilize it for anything with the office, much less be able to register or train patients in the use of it. Advanced slide. To aid this office in meeting all the stages for meaningful use, I was able to first begin to assess adult learning, cognitive theory needs amongst the staff. I did a thorough research of current literature relating to all aspects of the project, including requirements for meaningful use with Stage 3 reimbursement incentives. Once this research was completed, goals were made accordingly so that the office would be able to begin to meet the various stages of meaningful use, especially the later ones with Stage 3 and use of the electronic health record patient portal. A table listing the meaningful use requirements related to patient communications with electronic healthcare patient portals is included in the slide deck presentation prior to the references. And goals for the office were established so that staff was trained in utilizing the patient portal to be able to meet these. While not all staff were able to be trained up to this point, related to staff turnover and some technical problems with support for the portal as well. Within the project parameters, I have agreed to stay on with this office for another month to aid in completing the staff training for the remaining staff and the new staff coming on board. And also a portion of the patient training and registration is going to continue for that extra month as well to get hopefully them up to the required percentage for meaningful use of having patients registered and utilizing the portal. Future work needs to be done with this office to bring them to full usage of their electronic healthcare technology and converting their paper charting to fully electronic charting. The practice is also considering at some point in the future changing their electronic healthcare record software, in which case, unfortunately, most software packages for electronic healthcare records don't talk to one another. So it's difficult to transfer from one electronic healthcare record software to another. That's going to pose a problem that they're going to have to solve. Many things may actually have to printed in some form from the previous electronic healthcare record and scanned into the new one as available documents. They're also going to have to convert all their paper charting over into the new electronic healthcare record as well. It may actually be good for this office to do that. The current software they're using is very not user friendly. It does not mesh well between the portal and the electronic healthcare record. They actually have to go in and out of separate programs. I was able to help them to look at and evaluate new software programs that are more geared toward a provider practice, as well as being very centralized into one program and just being better overall for their staff and their patients. Thank you for your time.